Hello, I'm Bridget. Welcome to the Reading Hospital Regional Cancer Center. Berks Hematology Oncology is located on the main floor. Our state-of-the-art cancer center features ample parking, free valet service. The main lobby features the Tower Cafe, a gift shop, and the Image Recovery Center. The radiation department is also located on the main floor. Connecting you to Berks Hematology Oncology practice. We will take you on a virtual tour of our facility. This will familiarize you with the areas where you will receive your treatments, see your physician or their nurse practitioner physician assistant for a visit, and spend time with our skilled nursing and office staff. Our nursing staff will guide you through your chemotherapy treatment and begin to prepare you for your first treatment. BHOA. BHOA Health Team has been providing quality cancer care since 1968. We are committed to providing our patients with the most up-to-date information about their treatment. Your involvement in your treatment plan is encouraged. Chemotherapy Connections. We will start your education about chemotherapy with some helpful hints, possible side effects, and ways to lessen them. We need you to take an active role in your treatment. It is important to let your physician or your nurse know how you are doing. Remember, previous medical conditions must remain under the direction and care of your family physician or specialist. Getting started. The virtual tour and overview of chemotherapy is a start to becoming connected to Berks Hematology Oncology. The specific details of your treatment plan will be discussed with you, your physician, and your nurse. Please feel free to ask questions and let us know what we can do to support you and your family.
Hello, I'm Janet. I would like to discuss the chemotherapy potential side effects with you. Chemotherapy is a specialized drug treatment that is customized to provide you with the most effective way to fight your cancer. The occurrence of side effects are unique to each individual. There are many measures that will be taken to lessen or to eliminate these potential side effects. Side effects can be controlled, so please call the office with any problems so that we can help you immediately. The chemotherapy potential side effects are: your blood count will be monitored on a regular basis because your treatment can possibly lower your blood cells. The cancer and normal cells can be altered. If your white blood cells are low, you may be at risk of an infection. If your platelets are low, you may be at risk of bleeding. If your red blood cells are low, you may be at risk of anemia. Your healthcare team will guide you through these possible cell changes and their consequences. Your blood specimen will be run in our lab. A possible side effect is nausea and vomiting. Prevent these symptoms by avoiding fried, spicy, greasy foods, citrus, and tomatoes. Limit caffeine and chocolate. Take the medications as prescribed by your physician. Another side effect is diarrhea. Take medication as prescribed by your physician. Try the brat diet: bananas, rice, applesauce, and toast. Avoid raw fruits and vegetables and limit dairy products. A possible side effect can be constipation. Increase your fluids, fiber, fruit, vegetables, and activity. Take medications recommended by your physician. Do not wait more than 3 days without a bowel movement to take an over-the-counter laxative or stool softener. You might experience changes in your eating habits. If you would have a loss of appetite, altered taste, ulcers, or an infection of your mouth, your ability to eat might change. It is important to discuss any changes with your nurse and physician. There are many ways to combat these potential problems. Try small, frequent meals. Nutritional services can also be consulted for assistance. If necessary, a prescribed oral solution or antibiotics might be necessary. Chemotherapy can cause hair loss, skin, and nail changes. There are several chemotherapy regimens that alter your hair, skin, or nails. You may have hair thinning or lose all of your hair. Your skin may become dry or scaly. You may also develop a rash. Your finger or toenails may change color or texture. Your physician will inform you if your treatment will lead to any of these changes. Our cancer center has an image recovery center to assist you with these side effects. A common side effect of chemotherapy is fatigue. This is one of the most common side effects while receiving chemotherapy. It is recommended that you continue your daily routine. You should rest and then engage in physical activity. It is important to keep hydrated. Speak with your healthcare team if you're experiencing this side effect. They can help. Some chemotherapies can cause flu-like symptoms. Many of the chemotherapy agents can cause flu-like symptoms. These are fever, muscle aches, headache, and chills. Your physician will inform you if your treatment will cause any of these symptoms. It may be recommended that you take medication to alleviate these symptoms, drink plenty of fluids, and rest. There is also potential for allergic or hypersensitivity reactions. Many chemotherapy regimens include medications given first to prevent a reaction to the chemotherapy. These medications will be ordered to be taken at home or at the beginning of your treatment. Our staff will monitor your progress throughout your treatment. It is necessary to alert the staff if you would experience any symptoms such as shortness of breath, chest or back pain, or chills, or numbness or tingling of your arms, legs, tongue, or throat during the chemotherapy infusion. Our staff has special training in allergic hypersensitivity reactions to chemotherapy drugs. You might be interested in knowing about sexuality during chemotherapy. If you are of childbearing age, please speak with your physician or nurse. There are certain precautions that must be followed to assure your comfort and safety. It is important to speak with your partner about your feelings and concerns about intimacy while on treatment. When you should call the office. If you have a true medical emergency, dial 911 and go to the closest emergency room. If you are short of breath, have chest pain, or a nosebleed that you are not able to stop, go to the emergency room. If you feel feverish or are experiencing frequent chills, check your temperature. If it is over 100.5, take Tylenol. If your symptoms continue, please call our office immediately. If the following symptoms can wait to be addressed, call the office between 8 a.m. and 12 p.m. so that we can assist you with these issues in a timely fashion. If you bleed or bruise easily, have a new skin rash from your treatment, call the office. For any of the following signs and symptoms of infection, which include burning with urination, mouth sores, redness, swelling, or tenderness, especially around a wound or a previous IV site. For nausea, vomiting, diarrhea lasting more than 24 hours, despite using the physician-recommended medications. For symptoms of dehydration, such as pale or dry skin, less urination, and not being able to drink or eat for 24 hours. If you have not moved your bowels in 3 days despite using stool softeners or laxatives.
The Reading Hospital Regional Cancer Center promotes services such as social service, psychiatry, psychology, nutritional consultations, and a nurse navigator trained to guide our patients through their cancer center experience. We encourage you to become involved in various support and wellness groups. If you are interested, please speak with your nurse. Healing Garden. We leave you with a view of the Healing Garden. This is a place to provide a quiet sanctuary of beauty and inspiration. It is meant to give you hope, peace, and joy for your mind, body, and spirit. We hope this video has been enlightening and was able to put you at ease. Feel free to ask our staff any questions about our facility and your treatment. Let us know how we can help you throughout your treatment. Making a connection with you that you can trust is important to us.